Hi everyone, this is Rebekah again, and we really hope that you have been enjoying our menopause series so far. Thank you to those who have reached out to us, and please continue to let us know what you have found helpful, if you still have questions or anything like that. And just a reminder that this is meant as education. It is not meant to take the place of talking to your healthcare provider and one-on-one interaction. But today's video, we are going to be discussing osteoporosis. Some may be thinking, why should I care about osteoporosis? I'm young. Osteoporosis is for old people. So osteoporosis is actually a much bigger problem than we think. And globally, the risk of an osteoporotic fracture, not of having osteoporosis, but of an osteoporotic fracture, is 30 to 40%. So it is actually quite a big risk. We're going to see how it actually, menopause is quite related to osteoporosis. And the good news is, while we are young, we can do things to prevent osteoporosis going forward. So I hope you enjoy this video and that everything is clear. So to begin this overview of osteoporosis, I think we first need to look at what is osteoporosis. So osteoporosis is a decrease in the density of the bone. If you see in this picture where the pen is pointing, you can see that that bone is less dense. Less dense means more fragile, and more fragile means an increase in the risk of a fracture. This loss of density particularly occurs in the spine, the hip, the pelvis, the wrist, and the upper arm. So what on earth does menopause have to do with osteoporosis? Well, two things. Firstly, we've said that when you go through menopause, there's a decrease in your hormones, particularly your estrogen and your progesterone. That decrease in hormones leads to an increase in the resorption of bone. So early menopause before the age of 45 is an independent risk factor for developing osteoporosis. The other thing is that increasing age, regardless of when you went through menopause, increasing age leads to a decrease in the formation of new bone. So therefore we can see that going through menopause and advancing age contributes to the risk factors for osteoporosis. This age and risk factor is applicable to men as well. So women over the age of 65, men over the age of 70 are at a higher risk for osteoporosis. Osteoporosis is diagnosed on a BMD, a bone mineral density test, which is done at the X-ray department, and they develop a T-score based on their scans, and with that we can see whether there's osteopenia, osteoporosis, and in which areas the bone is thinning. And we really need that information in terms of making a decision on whether or not you need treatment. So whether or not you need medical treatment depends on the disease profile, whether it's osteoporosis, what your fracture risk is, the site of the osteoporosis. It also depends on the patient, the age, the other symptoms, the other comorbidities. But there are things that you as a person can do, regardless of your T-score, regardless of your age, to help strengthen your bones, which will decrease your chances of developing a frailty fracture. So the first thing is diet, and the two things that are really important with diet are your calcium and your vitamin D. And it's recommended that we get our calcium and vitamin D primarily through our diet as opposed to supplements. But if we cannot get them adequately through the diet, then supplements are fine. And calcium, we should be getting 1,000 to 1,200 milligrams a day, and vitamin D 600 to 800 international units. Exercise is very important in terms of our bone strength. Walking is one of the best exercises, particularly for hip strength. It's recommended to try and walk 5Ks 3 to 4 times a week. And then resistance exercises, particularly for the lower back. And I think the main thing to know about exercise is that it's important to ask somebody who is qualified to give you advice in terms of exercising. When it comes to alcohol, the recommendation is 2 units a day. And then smoking is just a no-no. Smoking by itself is a risk factor for just about everything, and we really don't recommend it at all. When it comes to the medication for treating osteoporosis, there are two main groups that are available in South Africa. The first is HRT, and Steph is going to do a whole video on HRT and the different pros and cons, but because HRT gives the hormones, particularly the estrogen, it helps to decrease that resorption of bone. However, if you are not on HRT and have been through menopause more than 10 years ago, or you are over the age of 60, it's not recommended that we start HRT for the treatment of osteoporosis. And then the main group that we know of is bisphosphonates. These are usually given in tablet form. They're given once a week. You should take them on an empty stomach with water and can cause some GI side effects. And after taking it, you should sit up for 30 to 60 minutes, and this helps to increase the density of the bones. I hope this introduction and overview of osteoporosis was helpful, and again, please, if you have questions or queries, don't hesitate to ask us or to contact your healthcare provider.